For over 30 years, doctors have given babies a hepatitis B shot hours after birth, but now health officials are rethinking this. But why? Well, 14% of pregnant women are not tested for hepatitis B, either due to refusal or inadequate parental care. But this can cause infection in their children, which can cause short-term or chronic illness. Now, today I'm going to talk about why the CDC might change its guidelines, what hepatitis B really is, and whether this shot is still necessary in 2025. So first, what is hepatitis B? Hepatitis B is a viral infection that attacks the liver. Now, this can cause chronic infection and lifelong liver damage and potentially liver failure. Now, how does hepatitis B spread? Hepatitis B spreads through blood and other bodily fluids, and it's 100 times more infectious than HIV. Imagine this, a small speck of dried blood on a towel. After weeks, someone touches it and uses the towel. Well, that's transfer hepatitis B. But today I'm going to be talking about another way that hepatitis B can spread, and that would be through birth from a mother to her child. Now, this is very risky to babies, as 90% of babies who get hepatitis B in the first year of their life get chronic hepatitis B that lasts for the rest of their life. And this can cause many complications. There are barely any symptoms, so until the time that it's detected, lots of damage has been done to their liver, and a lot of times they can't recover from this. Now, what do they do if a mother tests positive for hepatitis B? Well, first the mother is given an antiviral treatment, and then her child is given a hepatitis B shot. But first, let's talk about the history of this recommendation. It started in 1982 when this shot was recommended for people that are more at risk, for example, healthcare workers. It was then expanded in 1991 to include all infants, and they should be vaccinated straight at birth. It was then recommended to other children who had not yet been vaccinated. The goal of this was to reduce hepatitis B levels in acute infections in the United States. The results of this were great. Acute infections dropped by 99% in teenagers and children between the years of 1990 and 2019. Now, this was huge improvements. Now, today, vaccination rates still remain quite high, although they have slightly decreased, and acute infections, their levels are still very low. Now, some parents are now questioning whether this vaccine is really needed on day one. Why is it really necessary? Well, when a mother has this disease, it almost certainly can and will transfer to her child if no intervention is needed. Therefore, this vaccine prevents it and prevents that from happening. But still, some parents question, if the rates are so low in the United States, do we still really need it on day one? Now let's talk about the medical perspective. Well, there were some gaps in screening, as I mentioned before, with some mothers skipping it entirely, about 14%, and also there's some negatives that occur. Now, this can cause some problems for children, especially with the rare negatives, because the parents aren't sure if they have it or not. So, providing immediate protection is the safest and most reliable way of protecting children from hepatitis B. And as I mentioned before, if this is not done, 90% of children that develop it in the first year will develop chronic hepatitis B. But how safe and effective is the vaccine? Well, it protects around 98% of healthy children, and it has some side effects, fever, soreness in the area where they've been vaccinated, and they can also have fevers and headaches. However, many parents see these side effects and then pick to not have their children vaccinated due to these side effects. However, actually having hepatitis B is much more dangerous than the side effects themselves. And that is why doctors emphasize that it is the safest approach, and they strongly recommend all parents to take this approach and risk the side effects that come with it. So what's the conclusion here? So while hepatitis B is currently rare, stopping vaccinations would put millions of children at risk. The vaccine has currently saved millions and continues to do so every day across the world. What's important here is to remember to always consult your doctor before making individual decisions for individual children. Thank you for watching this video. I hope you found it useful. If you have any experience or information on this topic, or if you've researched on it yourself, please let us know in the comments. We will be reading them.